Hello, this is Dr. Grande. Today's question is, what is schema therapy? If you find this video to be interesting or helpful, please like it and subscribe to my channel. That way you won't miss anything new. Now, when we talk about schema therapy, we're talking about a treatment modality that was developed in the 80s by a clinician named Jeffrey Young. And it was specifically developed to address personality disorders, or in some cases, chronic and complex characterological problems. To answer this question, what is schema therapy, I'm going to be using an article that was published in 2012 by Masley and colleagues. And in this article, they reviewed a number of articles about schema therapy over the years, particularly about how effective schema therapy is for certain types of psychopathology. So schema therapy is a type of CBT, cognitive behavioral therapy. And CBT really is a family of modalities. And we could think of schema therapy specifically as being a modified version of Beckian cognitive therapy developed by Aaron Beck. So we see four parts to schema therapy: early maladaptive schemas, schema domains, schema modes, and coping styles. So with early maladaptive schemas, here we have a dysfunctional, stable theme that develops starting in childhood, and it has emotional, cognitive, and memory components to it, as well as bodily sensations. And these are about the self or about others. So really this type of schema isn't a lot different than what we think of when we think of a cognitive therapy schema. These early maladaptive schemas develop for a variety of reasons. And again, the start of the development, of course, is in childhood. So it's thought that if a child is exposed to hostility, neglect, criticism, or there is a failure to meet core needs, that these early maladaptive schemas can take hold. Now, there are a number of different types of early maladaptive schemas, but in schema therapy it's thought that they all fit in 5 domains. These are the schema domains: disconnection and rejection, impaired autonomy and performance, impaired limits, other directedness, and overvigilance and inhibition. So here we have the early maladaptive schemas and the schema domains. So moving to the coping styles. Coping styles are initially used by individuals who are developing these schemas to survive, but eventually they start to maintain that maladaptive schema. And there's 3 main types of coping styles in schema therapy. Overcompensation, this is fighting the schema. Surrendering, this is somebody giving into the schema. And avoidance, this is somebody trying to avoid activation of the schema. So the last component is the schema mode. And the schema modes are really groups of schemas. Particularly these are used with schema therapy for complex disorders. And one of those disorders is borderline personality disorder. So really this is just a way where schemas are grouped to aid in the logistics of treatment. Now, schema therapy has a few different goals associated with it, but the main goals would be to develop close relationships with others and to promote self-care. And these 2 goals are achieved through a variety of techniques that are used in schema therapy. One is reducing maladaptive coping behaviors, another is developing adaptive schemas, and there are also a variety of other cognitive behavioral techniques used in schema therapy. These techniques are used to try to repair early damaging experiences and to help identify unmet needs. So the therapeutic relationship is really an important part of schema therapy. It's not just about really strictly cognitive and behavioral strategies. That therapeutic alliance is also a key part, and it's used in schema therapy to be reparative and restorative. So is schema therapy effective? Again, we know that schema therapy was developed to treat a few different disorders, including personality disorders. Well, looking at the study I mentioned before, we see there is a lot of research on borderline personality disorder and some research on other disorders. With borderline personality disorder, schema therapy appears to be promising. With some of the other disorders like post-traumatic stress disorder, substance use disorder, and eating disorder, we see some studies with schema therapy and these disorders, but there are some difficulties in terms of the research methodology. We see certain factors like low sample size, no control group, no random assignment, and mortality, meaning individuals are dropping out of the studies. So I think we need a little bit more research, and more research with solid methodology to really make any conclusions about those other disorders, and really we need more research for borderline personality disorder as well. So overall, the research results are mixed when you consider in some of these methodology difficulties. However, I do believe there's enough evidence to justify further research, again, particularly further research where the methodology is more solid. And I'd be curious to see what these results reveal in the future. I hope you found this description of schema therapy to be interesting. Thanks for watching.